New York. I presented today at the International Congress of Cardiology. My topic was clinical effectiveness of CRT and ICD therapy in patients with heart failure, findings based on race and gender from the IMPROVE-HF study. IMPROVE-HF was a practice improvement intervention study that was done in the United States over a period of several years, whereby we examined practices who took care of patients with heart failure throughout the United States and used a practice performance improvement initiative to see if we could improve outcomes in patients who have heart failure. So we looked at a variety of things such as drug therapy, but what I concentrated in my talk was on ICD and CRT therapy. The point was to look at what kind of utilization of guideline-indicated therapy was used in these patients at baseline, and to see, by using a practice performance improvement initiative, whether we can improve that over a period of a 2-year follow-up. The overall findings of the study were that we did indeed improve the utilization of guideline-based medical therapy as well as device therapy over the course of the study. We then did a sub-analysis looking at differences based on sex as well as race. When we looked at men versus women in the IMPROVE-HF study, we found that women at baseline had a lower utilization of guideline-indicated ICD and CRT therapy compared to men, but that over the 2-year period of follow-up, both sexes had great improvement in the utilization of therapies, and very importantly, women actually had a better outcome with respect to mortality than men did with the use of CRT therapy. With ICD therapy, the outcomes were equivalent, so they both benefited. The bottom line in terms of sex and device therapy is that both men and women improve, and they should both be offered the therapies if they are indicated for it. Finally, we looked at race and ethnicity. And when we looked at blacks versus whites and then Hispanics and other genders, what we found was that outcomes were equivalent with both ICD and CRT therapy. The one exception was that black non-Hispanic patients didn't have a significant improvement compared to the other races and ethnicities, but the sample size was small. So we finally concluded that patients should be offered guideline-based device therapy, both ICDs and CRT, without respect to sex, race, or ethnicity.